Hi everyone, my name is Ridley Parikh, and this is my community project for PHYSCI 121. Throughout this course, we have learned about the intricacies of Duchenne muscular dystrophy, known as DMD for short. We have learned that to treat and help patients with DMD with care and hopes for the best outcome, there needs to be a big team of physicians, mental health support, family, and friends, and what we're going to focus on today, which is physical therapy. For my community project, I decided to interview a physical therapist who has worked with DMD patients throughout her career. We are going to dive into her experiences, get a better understanding of the nuts and bolts of what a PT does for DMD patients, and any hope she has for the DMD community. So I welcome Pinky Parikh, a physical therapist who specializes in sports medicine.
Hello.
Hi. Hi. Okay, so before we kind of dive into talking about the specifics about DMD, if you want to go ahead and give a quick background about yourself, a quick introduction background, and how you came to work with DMD individuals.
Okay, so I've been physical therapist for about 20 plus years, and I have done both the um, physical therapy in hospital, outpatient, and also in rehab settings, short-term rehab, long-term rehab type of case. And I have seen patients with DMD all in all the settings that I have worked with in hospital, and then also very good experiences in my outpatient physical therapy.
Amazing, great to hear. Um, so I guess just kind of to start us off, why do you think physical therapy is important for individuals with DMD?
I personally think that it is very important because as it is, GMD is a genetic disease and it is a progressive disease. So there is really no actual cure for it as of yet. So basically, the maintenance of the muscles, the joint, the flexibility is very important. So I think although like medicine does play a good role in the maintenance of the DMD progression, physical therapies aspect helps patients be more independent in their activities of daily living.
Yeah, absolutely. Throughout our class, we definitely learned about how maintaining independence for DMD patients is very, very important. So it's good to hear through physical therapy. That's definitely an aspect. Um, so what does a typical session with individual DMD individual look like at different stages of progression? So like when they're first starting out physical therapy towards maybe their latter half of their time doing physical therapy.
So I don't have a really good experience with younger patients, although when they're diagnosed, they're very much young adults or young kids. And then as they get older, the disease obviously takes a little bit more aggressive toll on their body. So basically, the the session basically starts with either the pain management, depending on because the muscles are fatiguing at the very rapid rate. So the maintenance of the pain is very important, and then also the strength and flexibility. So we work a lot on that. We also work on balance training because the individuals, as they're learning to walk when they're younger, or when they are so we want to fall prevention is a very big aspect of physical therapy for these patients. Maintenance of the posture, the bed mobility and transfers, all of those are very important, and different muscle groups play a role in that. So in a typical session, we always work with some sort of pain management, some strength training and flexibility training, and some neuromuscular education with balance and proprioception training.
And that treatment would adjust based on
The
what that
age.
person's capacity is at that time.
Correct, correct. Like some patients may start with cane and they need to be adjusted to use a walker. Some people start coming in with because of the strength, they start with the wheelchair and then we progress them to walker, depending on where they are, because we want to like see what their needs are to keep them as independent as we can.
And typically, how many times a week would you recommend somebody with DMD to
So
come in?
twice a week is what we recommend. Most of the time, there is a home exercise program that goes along with it. So we trust that the patient will be able to take care of some of the exercise because, like I said, like coming multiple times in the facility is also a lot of work for them. So we try to cater like twice a week, and then there is a home exercise program that they go home with.
Great to hear kind of more about the mechanics and exercises that physical therapists um, help DMD patients with. So now I kind of want to dive into talking about a little bit more like a personal impact story slash talking about quality of life when it comes to individuals with DMD, because that's something we definitely dove into in our class. Um, so would you mind sharing a story that had some sort of lasting impact on you and something that patient specifically taught you?
Um, I personally feel that there are, because the disease progresses over course of time, which muscle group comes first? Whether it's your leg muscles, whether it's your respiratory muscles or your cardiac muscles, depending on that. But I have one particular patient that I can never forget. Working with him is the problems they started having with their own personal hygiene. And that really left a big impact on me. And I don't want to go into details of what the situation was, but them coming and talking about them and dealing with that left a big impact on me, like because they just were not able to take care of themselves personally with their personal hygiene. And that seems very small, but it is a big part of like the muscle group that needs to work with, and they just can't coordinate. Their muscles just start fatiguing, and so that left a big impact on me.
Yeah, I'm sure. And so that was one of those moments where you, even though it's not your specialty, you had to kind of learn to emotionally support a patient over just physical support, correct?
Correct. And that was very big learning for me that, we could do everything we can, but like some days the patients just have to give up, or they give up on not having to take care of themselves. And it's just hard to like keep them motivated.
Yeah, absolutely. I can only imagine. And so that's also kind of a moment where maybe you're even learning to prioritize quality of life over the physical treatment, correct? Because
Yeah.
even though your specialty is mobility and strength and endurance, like just understanding that their quality of life is also maybe going down, just being a listening ear is very important.
Yeah. And typically, because it's genetic, they have seen some sort of family member dealing with it at home also, whether it be mom or dad. And so, like, just to make them understand that this is just going to get a little worse as the time progresses, but to keep them like as independent as we can, but also like emotionally, like support them that we are here for you, and there's community out there. If you need any additional support, there are support groups, so like kind of refer to them in that direction is good in part. Yeah.
Absolutely. Kind of to change gears a little bit, do you find that there are systemic or social barriers that your DMD patients have had to kind of face, and like, are there sort of social stigmas that they've had to deal with that you've also had to be there for them emotionally and physically the best way you can?
Yes, there are incidences where the patient is declining, like I was just mentioning earlier, because they come in an outpatient setting where there are other patients that are also here. It's hard to kind of make the other patients realize that certain things this patient is not able to do could be just related, without giving away the diagnosis. Obviously, that's, HIPAA applies. So just try to make the patient understand. I mean, this other patients understand that, try to uh, be more mindful of why this patient is dealing with, because they are just probably having a bad day. Their, functional is declining, but then there are days where good days where they are able to do certain things. The medication is working properly, they've had a good night's sleep, or, they're if they ate properly or not. All of that is part of it. So, to make others understand that, just give them a little space. Sometimes getting in and out of bed takes a little longer, or getting in and out of bike takes a little longer. Just be more mindful of it. So that is actually a very big part of physical therapy, where you're working with other patients who are like more young. They're able to do things a little bit more faster, but then like there are patients who are able to do them slower. But that part of it is hard to deal with as a physical therapist sometimes.
Yeah, I can only imagine. And so would you say that that also creates some sort of barrier in terms of accessibility because some patients might have more access to better wheelchairs, which makes them a little bit faster in moving versus maybe a slower kind of system? Is that like made a difference in their time at therapy as well?
Yes, yes, for sure. Like if the patient comes with the walker, it takes them a little bit longer, but now they have like a power chair. So some patients come in a power chair versus a manual chair or a walker. So it does make a difference on what stage of the disease they are, and what they are able to afford with their own insurance.
Yeah, absolutely. So you also kind of mentioned having to explain to other patients or telling other patients to just be more mindful and considerate when there is a DMD patient in office. What do you wish that more people knew about DMD in general and those who live with it? Like how would you want to go about educating them maybe?
I think it's very important that the patient themselves are more aware of what their diseases are, and if they are educated about their own disease, then they can maybe explain it to the other people around them a little bit more, not better, but like more. I think people, like, if I had, for example, a surgery, if I tried to explain something to the another individual, it comes off a little bit better, like that the patients are more empathized, like understanding of their situation. So I think it's like individual themselves learning about their own disease, because that also is a big part of, because them not knowing that they're progressing at this rate. There's really no actual treatment for it towards the very end, unless they do gene therapy or something like that. um, I think that would be very important, that like the doctors may be explaining them what their diseases are and give them literature to study.
Yeah, definitely. Um, I guess how does your role kind of challenge or confirm assumptions that people often make about physical therapy for a chronic progressive condition like DMD?
Like
What,
with any other disease, it's like the patient's reaction to the disease. So it's just basically, um, maybe repeat the question again, so like I understand what you're
yeah,
trying to
so how
ask.
does your role kind of challenge or confirm the common assumptions people make about DMD individuals? Like, do you find that um your place as a physical therapist, like you can see the assumptions people make and you see that those are maybe correct, or do you feel actually the opposite, that these assumptions that individuals are making are actually quite incorrect and it's very like individual based and experience based?
Both. I think it's a little bit of both. Some people do, for example, if there's two same patients with the same disease, whether it be a knee replacement or any other, everyone body is going to change, react to that particular disease or problem differently. So keeping that in mind, that everyone. So there are definitely people do. speculate that certain things are going to be like this, or why are they not doing it like that. Like two same individuals never have the same um, outcome of the same disease. So I think I have noticed that people just assume sometimes that why are they not doing well? And then on the flip side of it, there are times where, like they should, it's nice to get motivation also from certain patients then, that's also, like if somebody is not doing well and somebody else motivates them, that also is also helpful.
Yeah, absolutely. And I think your role probably as a physical therapist is definitely knowing when to extra motivate and push the patient, but also knowing when there's a moment to take a step back and be like, okay, today's just not the day. So I
Yeah.
think that is definitely an assumption. Maybe people don't really understand that some days are better than others
Yeah.
and yeah. Kind of to shift gears a little bit towards the end of our interview, is there any sort of recent therapies or uh, technologies that you've read about or seen that looks promising to you, whether that's equipment or therapies, whatever you kind of know and about?
So, from medical standpoint perspective, there are gene therapies that are, being tested. There are also different various medications that they're testing to see, how to limit the progression of the symptoms mainly. And then from physical therapy standpoint of view, there are a lot of mobility equipments that they come up with. A lot of sometimes the manual stretch or the self stretch is not sufficient, so there are a lot of devices that kind of helps them stretch them. There are splints, there are braces, and the most recent one that they have, and it's been in market for a long time, and it's for different types of patient, is a standing frame. And I think that is actually one of the where it actually helps the patient from sit to stand and then keep them in the standing position for X amount of time, so that the weight bearing of those muscles and activations of the muscles throughout their whole body takes place. And I think that's the progression that they have come up with from physical therapy standpoint.
Amazing. It's good to see that not the research isn't just going into medicine, but which is obviously very, very important, but also like that mobility and strength, endurance and maintenance. Kind of to wrap up our interview, what message would you like to share with future clinicians or caregivers who work with DMD?
Um, be patient. Every day is a different day for them, like anyone of us, yeah, be understanding, like understand what the disease is, how it progresses, and what is the best you can do for them on that particular day, keeping in mind that, strength, mobility, and functional independence is the goal. So the key is the patience, both emotionally, physically, and mentally for the patient.
Absolutely. And what I guess you kind of answered it, but I guess what gives you hope as a provider in this field as a physical therapist and working with rare progressive diseases? What is something you're hopeful for in the future?
I'm just hoping that there will be medications available in the future, including gene therapy, so that can take care of the patients from inside, and then so that the physical therapy portion of it becomes a little bit easier for the patient. Because there are side effects to these medications. There are things that our patients are not used to within their body. So I'm hopeful that, they will come up with the medications that are not aggressive for the patient.
Absolutely. That's great to hear. Well, that's kind of all the questions I have for you. Thank you so much for taking time out of your day to do this interview for us. And I hope that everyone watching definitely had an opportunity to take a little bit of a scope into physical therapy for DMD individuals and learn something new. Um, yeah, thank you so much, everybody, and we'll see you next time.
Thank you. Bye bye.